This is a quick presentation on how to enter existing restorations into your EagleSoft. So you're going to make sure you're in the patient's chart. So you'll have the name up here with the patient ID number, and you're going to click on chart. This screen comes up pretty often, so we're just going to press OK, or you can press exit. Doesn't matter. So when you are placing restorations into EagleSoft, you're going to do this through your clinical and your radiographic evaluation. So some of the common ones that we have for restorations is going to be resin, crown, the RCTs for root canal. Here is a lingual bar for your patients with ortho. You have an amalgam, and then you have EXT for extractions. So those are probably the most common ones that you're going to use. Resin, let's start with that one. This one is going to be your composites. When you click down on this box, you're going to have different things that you can choose from depending on which tooth and which surface. So you'll see post here on this one, this one, this one, and this one. That's all posterior teeth. And you can see you got a 4 surface, 1 surface, 3 surface, 2 surface. Okay, so let's just say I find an MO on number 4. So I'm going to click on number 4, and that's going to highlight the tooth. Then I can go over to resin, click the down arrow. I know it's an MO, so I know that's a 2 surface composite. So I'm going to find the 2 surface. I'm going to click on it. Once I click on it, I need to make sure that I click on existing. Okay. If I say proposed, then that means that the treatment needs to be done. But it's existing because the filling has already been completed. And then down here, I'm going to click the surfaces. So I said it was an MO, so I'm going to click mesial and occlusal. I'm going to select or click OK. And now 2 things are going to happen. You're going to see the restoration here on the tooth chart, but it's also going to be down here in the box. So depending on where the tooth is and what the surface is, that's where you're going to choose which one here. Like the anteriors, you got a 4 surface, you got a 1 surface, a 3 surface, and a 2 surface. Oh, I'm come back in there. We're going to press OK. Okay, the next one is crown. There are different types of crown and bridges down in here. The most common crowns that we see is going to be full cast, which is going to be your 2792, or your full porcelain, which is going to be your 2740. The others that we use, oh, I apologize. The other one that we use is going to be root canal. There's your anterior, your bicuspid, your molar. For your amalgams, you have your 1, 2, 3, 4 surfaces. You have your lingual bar. Here is your sealants. So depending on where it is, that's when you're going to click the tooth and then click on these services. Now, even though we don't diagnose, we do still document suspect decay, which is going to be that conversation between you and the doctor during the radiographic interpretation and the clinical assessment with you and your instructor. If any suspects are reported, what we're going to do is we're still going to put them in the chart. Now it's right here. You're going to see SC. Okay. If you click on this box, it will say suspect decay. So let's just say we found suspect decay on number 30. So we're going to click number 30. We're going to click suspect. And then we are going to put in the surfaces. So let's just say we saw it on the mesial, occlusal, and distal. Press OK. Then what that's going to do is it's going to turn red. Okay. Red means it needs to be done. Okay. So we have a suspect decay on number 30. It's an MOD, and the status is condition. And the reason for that is because we are not going to propose this because we can't diagnose and it's not existing. So it's automatically going to default to condition. Now, when you are presenting this to your instructor, one thing that's kind of nice is if you hit status twice, it will bring up all of the it will clump the existing, the proposed, and the conditions together. So it creates a better way for you to deliver this information to your instructor. I hope that helps. And if you have any questions, please let me know.